Are there less invasive ways to check for ulcers? If you suspect you might have a stomach or intestinal ulcer, you might wonder if there are simpler ways to find out without going through uncomfortable procedures. Traditionally, doctors used endoscopy, which involves inserting a flexible tube with a camera through your mouth to look inside your stomach and upper intestines. While endoscopy is very accurate and considered the gold standard, it can be invasive, costly, and sometimes uncomfortable. Fortunately, there are non-invasive options that can help detect ulcers or related infections. One of the most common methods is testing for Helicobacter pylori, a bacteria that is strongly linked to peptic ulcers. Detecting this bacteria can often confirm the presence of an ulcer or help guide treatment. One of the most accurate non-invasive tests is the urea breath test. In this test, you drink a solution containing a harmless isotope-labeled urea. If Helicobacter pylori bacteria are present, they break down the urea, releasing carbon dioxide that can be measured in your breath. This test is quick, safe, and highly reliable for detecting active infection. Another option is the stool antigen test, which looks for Helicobacter pylori proteins in a stool sample. It is also non-invasive, affordable, and effective, especially for confirming whether the infection has cleared after treatment. This test is convenient and can be done at home or in a clinic. Blood tests that look for antibodies to Helicobacter pylori are also available. However, they are less useful for diagnosing active ulcers because they can remain positive even after the infection has been cleared. Therefore, they are mainly helpful for identifying past exposure rather than current disease. Beyond bacterial testing, emerging technologies are being studied for ulcer detection. Some research focuses on bioimpedance systems, which use electrical signals applied to the skin to detect changes in tissue properties associated with ulcers. These methods show promise but are still in the experimental stage. Other non-invasive imaging techniques, like thermal or hyperspectral imaging, are being explored for monitoring wound healing in ulcers, especially in diabetic foot ulcers. These methods use specialized cameras to assess blood flow and tissue health without touching the skin or using radiation. Overall, non-invasive tests are valuable tools for initial screening, monitoring treatment success, and reducing the need for invasive procedures. They are more comfortable, less costly, and more accessible. However, if a non-invasive test indicates an ulcer or if symptoms are severe, your healthcare provider may still recommend an endoscopy to confirm the diagnosis and check for complications. In terms of prevention, regular screening with these non-invasive methods can help identify risk factors early. This allows for lifestyle changes, such as improving diet, reducing stress, and avoiding irritants like non-steroidal anti-inflammatory drugs, which can help prevent ulcers from developing. Always consult your healthcare professional to determine the best approach for your individual health needs and ensure proper diagnosis and care.